Hello and welcome. This is Jim Karp along with Curt Nurenberg. Curt, glad to have you back.
Hey, great to be back.
All right. We had a chance to talk about the startup as a lot of the dental practices were reopening. You had a lot of really solid points to consider at that point in time to say, hey, if you're getting ready to get your practice up and running, here's some considerations that you need to look at. How has it gone for your clients so far?
Overall, it's gone pretty well. I would say the changes that they've had to make in their offices, both from a safety perspective and compliance with laws and regulations, have gone well. The personal protection equipment, the inventory, and making sure that all their ordering and things like that have gone very well. Getting their employees back off of unemployment, getting them integrated back into the office has been a challenge, but I think there's been a lot of success. Cash flow is starting to pick back up, so I think people are very encouraged about the cash flow. And now the major consideration is just getting patients rescheduled.
Okay, so when you're looking at scheduling patients, I know that can be tricky at times. So are there some insights that you've got that you could share with these practices that they might want to take into consideration as they're starting to get the schedule set?
I think the major considerations, especially for general dentistry, periodontics, and pediatric dentistry, is the rhythmic scheduling that they have as far as a common practice. What happens now is an indicator what's going to happen 6 months from now, and then what will happen 6 months after that. So if you throw off your rhythm, that is something that can not only affect you now, but could affect you well into the future. So our goal right now is to identify what can be done now to make sure that that rhythm is not broken. And what I've indicated to my docs is that patients were not seen in April or May. So those patients also cannot have their appointments already set for October, November. So what we have to do is get these patients situated in a capacity that we break them up into 3 categories. And those 3 categories are: 1, who needs to be seen right now; 2, who are patients that could be seen if we have gaps in the schedule; and then 3, who are patients that can wait. And you might say, wait a minute, why would you want patients to be held off? I can tell you this. So many offices right now are trying to cram all the patients in. It can be a safety issue. The doctors are getting burned out. The team is, perceiving you're just trying to cram patients in. They're feeling the pressure. The team is getting burned out. And lastly, overtime. So as you're trying to pack everything in, it's putting a big burden on that business, on that practice. And then lastly, if you're doing all this, the major consideration still is the personal protection equipment. So the goal is to say, let's spread this out and get these patients in a templated schedule that still makes sense. And with a major goal at the end of this is making sure we don't have a non-anticipated or an unanticipated shutdown in October, November, just because we didn't have the forethought to make sure we have patients in that schedule when we get to that point.
Curt, just as a side comment, I just yesterday had the good fortune to go get my first haircut that I haven't had in a long period of time. It was at 6 o'clock at night, and when I was talking to the hairdresser, she was basically working 12 hours a day, and she was burned out. And one thing that goes through my mind too is the interpersonal skills and the interactions with the patients. And kind of my thought while I was sitting in the seat was, I need to get in here, get out real quick, because she's in a hurry and she's got other people that she's got to get going too. So I got to believe that has something to do with impacting a practice for the dentist as well as the time and energy and that interpersonal play out as well.
It is. This is the time where patients actually need to feel more comfortable.
Yep.
They need to have even more communication, even if it is, through a mask. Patients, when they're walking in, they're having a little bit uneasy feeling, but they don't want their experience to be so-called sacrificed or cheapened. So many offices are having to take their appointments from a traditional 40-minute to 50-minute appointment, making it to, a full, hour and 10 minutes, just to allow what needs to happen to make sure that patient feels like they feel safe and taken care of when they get to that office.
Yeah, and actually, I felt the opposite yesterday. I was kind of like, hurry up, get out of here. I got the next person coming. And so I think that can have an impact as well.
Yeah. The interesting part, Jim, is, we've talked about these patients and the hygiene appointments and things like that. And then what happens, 6 months out, and, what some people wouldn't realize is they'll say, well, it's just my hygiene. That'll fill. Well, you won't have enough new patient volume to fill up those appointments from what would have been the 6-month appointment. But most importantly, the hygiene is the nice passive income for the practices, but where we're the main practitioner, or where the doctor makes his or her money, and where the patient is even needed more, is that restorative treatment. And those required treatments are identified in those hygiene exams. So if the hygiene exams are not happening and the doctors cannot specifically identify required treatment, the doctor's schedule will also be kind of shut down or very spotty, which is not going to make for a very happy doctor on a day-to-day basis.
Okay. All right. So what are your thoughts? How do we get this all taken care of?
I alluded to it a little earlier, to where you have to look at all the patients that their appointments were canceled during the time that the office was shut down. And you not necessarily prioritize them as far as who you like, who you don't like, as far as who you're getting in the schedule, but it does come down to a need. You have to classify the riskier patients versus the non-riskier patients, and use those as the rocks, the stones, the sand to kind of fill that schedule as need be. Not only for now, but well into the future, the next couple months, and even 6 months down the road. And even with that, a couple other considerations to think about is, some offices have mentioned that they're going to charge a PPE fee as these patients come back. So there's a couple things to take into consideration. One, making sure, if you're going to charge that fee, have you notified the patient ahead of time that you're going to charge this fee? Nobody wants to be surprised when they come to the checkout and they say, hey, you know what? Here's what was done today. Here's the corresponding fees. In addition, there's an additional fee you've never seen before. That's going to cause a little bit of uneasy feeling with those patients at that front. So education, communication to those patients up front. But the trickiest part is this. Many practices participate with insurance companies. And those participation agreements will dictate whether or not you can, one, charge out that fee for a specific PPE fee. Some insurance companies are actually reimbursing for those. Other insurance companies are declining those. And what you have to be careful of is whether or not you can actually still go collect that fee from the patient, or whether the contract that you signed with that insurance company would preclude you from being able to charge that patient separately. It's a very key aspect that people need to take a look at, because you do not want to get into violating the contract that you signed with these insurance companies.
Oh, that's a good point. Yeah. Okay. So we looking at it, then you're basically saying, hey, as you're running your business now and you're trying to be aggressive, one, look out to the future and make sure that you have your schedule put together. And that's the based on the patients that must get in, should get in, and can potentially wait. And then the second point I heard you say then as well is, if you are going to charge the PPE type of fee, make sure that you're not in contention with the insurance company. What other items or thoughts do you have that you can share with these practitioners at this point in time?
I think that those two concepts are very important. I think that's what I want to kind of communicate at this time. And I guess I would equate it to, if you're walking down someplace, if you're walking down a sidewalk, in a crowded sidewalk, and if you're always looking down at your feet because you're trying to pay attention to the next step you're going to make, you're going to probably run into, other people. You're going to run into obstacles in front of you. So I equate this to your dental practice. Don't look at just what has to happen in the next day, 2 days, and things like that. You need to look out 3 months, 4 months, 6 months. I'd rather stub my toe versus run into a brick wall.
All right, Curt, as always, it's very informative. I appreciate your time and energy. I know the doctors do as well, and we'll look forward to talking to you sometime in the near term.
Thanks a bunch, Jim. Appreciate your time.
Take care.